Welcome to Patty Sassano's final exam. We'll all discuss the process of assessment for learners with special needs. The process of assessment in special education will be reviewed in 7 areas of functioning, including intelligence, academic performance, behavior, social-emotional learning, language, physical development, and perceptual function. The Individuals with Disabilities Education Act views the process of assessment as an important role in determining the strengths and needs of all students for measuring the attainment of education standards within the core curriculum. Assessments help the multidisciplinary team of educators make decisions regarding strategies, interventions, and special education eligibility. When viewed from the lens of the contemporary model of assessment, the process of assessment can be seen as a problem-solving process that emphasizes finding a solution to resolve academic or behavior challenges at different levels of intensity. As such, we will review the assessment process for each of the 7 areas of function via the response to intervention model, including assessment best practices. In an attempt to avoid redundancy throughout the presentation, let's start here with a review of the RTI, response to intervention model, and assessment best practices, as both are integral in all 7 domains. RTI. The process of assessment within the school setting often begins in Tier 1, the least restrictive tier, in which informal assessments are performed within the classroom activity, to a more targeted at-risk Tier 2, involving small group instruction, usually for a specific skill, and then to Tier 3, which is often even smaller groups or one-on-one instruction for high-risk students, some of whom may be eligible for special education evaluation and interventions. Assessment best practices. The process of assessment in each of the 7 areas of functioning will include certain best practices. Let's review them here with an understanding that they are to be practiced within each assessment process. Problem-solving approach with a strong focus on early intervention is key, and these interventions should be evidence-based. Multidisciplinary teams provide a team approach which can consist of parents, a psychologist, special educators, speech and language pathologists, perhaps occupational therapists, classroom teachers, and paraeducators. Multiple measures are used to paint a more complete picture of the student to include informal assessments, such as teacher observations, parent interviews, curriculum-based measurements, progress monitoring, and formal standardized assessments, many of which are norm-referenced to provide comparison data, such as percentile rankings and age-equivalent scores. Ongoing assessments can include quarterly progress monitoring, yearly assessments, or with special education, a 3-year review. Cultural considerations, particularly for ethnically diverse students, including English language learners, are important for proper test selection and environmental assessments to ensure disabilities are not confused for cultural difference. Assessing intelligence. Intelligence or cognitive assessments are often used to assist in the diagnosis of learning problems and should be used in conjunction with numerous other formal and informal assessments. The process of assessing intelligence often begins much earlier than the administration of formal individualized intelligence testing. Using the RTI framework, for many students, the process begins on Tier 1. Within the general education classroom, informal assessments such as teacher observations and assessments, curriculum assessments, start to identify students falling behind grade level benchmarks. For some school districts on this tier, Tier 1, group intelligence tests may be administered, serving as another instrument in the data collection process. With the prevention and early intervention emphasis, Tier 1 screenings and progress monitoring provide additional assessment data. When the multidisciplinary team decides there is a need for individual intelligence testing, parental consent is obtained and the school psychologist or testing agent selects the appropriate battery of intelligence tests for the student. Example of the intelligence tests include the Wechsler Scales, which is overall intelligence with 3 different developmental levels, Kaufman Assessment Battery, which has a processing focus, Woodcock-Johnson, another global evaluation, and the Stanford-Binet, which includes reasoning and visual spatial processing. According to James Holdnuck from the Psychological Corporation, using a battery or cross-battery of tests is beneficial, as they can be used flexibly to pinpoint specific areas of strengths and weaknesses to help identify proper interventions. For example, if the informal data indicate the student has difficulty with processing, the Stanford-Binet Visual Spatial Battery may be selected. Or if the student is an English language learner, the Kaufman Assessment Battery might be a better choice because of its option to use a framework that's not heavily influenced by linguistics. An ecological or environmental assessment of the student should be performed so that any cultural or ethnic differences are understood and considered. This will help both with the selection of the cognitive test and with the test interpretation. On a final note, because of the strong correlation between standardized intelligence tests and school achievement, the Individual Disabilities Education Act mandates these tests for use of diagnosing many disabilities and special education eligibility. However, the results of standardized intelligence tests are to be used only as a small part of the aggregate data used in the decision-making process. Assessing academic performance. The process of assessing academic performance happens every day in every classroom for the purpose of informing the teacher about her instruction and for determining instructional interventions for the students. Using the three-tiered model of intervention, we can illustrate that academic performance be monitored routinely. Tier 1, universal monitoring, can occur using informal assessments such as curriculum-based assessments and curriculum-based measurements, which is performance within the curriculum, criterion reference tests, which is performance compared to a given criterion, performance assessments, for example, writings or writing portfolios, dynamic assessments, where we're assessing the student's capacity to learn a new skill, error analysis, where we're determining the error patterns of a student, and checklists to keep track of each student's performance. Within this part of the assessment process, the routine assessment of students, behavior is observed, progress is monitored and evaluated, and interventions are planned when students do not make needed progress. In the second tier of RTI, students receive small group intensive interventions which are continually monitored via the specific academic skills being measured, for example, reading comprehension. Students who do not respond to Tier 2 intensive interventions and continue to have academic difficulties may require even more intensive three-tiered one-on-one interventions and/or may be referred to special education eligibility services. This third tier should result in only 3 to 5% of the student population. It is in this section of the final exam where we will review the assessment process for special education eligibility, noting that formal academic assessments can be used at any tier for data collection purposes. Eligibility for special education services includes the following process: a pre-referral checklist, parental consent, an environmental/ecological assessment for cultural considerations in particular, an individual assessment plan where we review all screening information and data, decide if further evaluation is needed and choose the instruments, and decide who are the qualified test administrators. A comprehensive individual evaluation may include a battery of intelligence tests as well as a battery of standardized achievement tests. Standardized achievement tests can include an extended battery for comprehensive view of the students, for example, the Wechsler Individual Achievement Test, 3rd edition, or the Woodcock-Johnson Test of Achievement, or specific subtests or cross batteries of subtests for specific skill screening. Diagnostic tests yield more detailed information for making decisions regarding the correct educational interventions and may include assessments in reading, math, spelling, and written language. These can include the Woodcock Reading Master Test 3rd edition and the Key Math 3DA. Several of the standardized diagnostic tests take considerably less time to evaluate, such as the GORT-5 and the TAL-4, and some offer brief screening of specific academic skills like the Woodcock-Johnson 4 first 3 subsets and the Wechsler Fundamental Screening. These standardized tests are part of the overall academic and behavioral picture in conjunction with the array of informal assessments such as teacher observations, parent interviews, curriculum-based measurements discussed in our earlier slide. Assessing behavior. Some students struggle to learn in school because of behavioral challenges, whether they disrupt class, become withdrawn, or avoid school altogether. The process of assessing behavior can help in understanding student behavior by observing, describing, explaining, and predicting behavior, and then deciding how to intervene. Like intelligence and academic performance, the process of behavior assessment can be addressed using the three-tiered RTI model. Let's take a look. At the foundational level, Tier 1 represents the universal behavior support for all students. The school-wide positive behavior support consists of the rules, rewards, and consequences applied to all students. On this tier, consistency with consequences among teachers and staff is key to its success. Here we begin to identify students whose social behavior and social skills could be interfering with learning. At-risk students who move to Tier 2 are given appropriate behavior interventions such as mentoring and specific reward systems, and their behavior is monitored. As students move up the continuum of the triangle, their behavior may require more intensive, individualized interventions and perhaps administered through an IEP. Federal regulation requires the process of assessing behavior for an IEP include a functional behavioral assessment, known as an FBA. An FBA is an approach to figuring out why a student acts a certain way using various methods to collect assessment data and develop a behavior plan. There are 3 basic steps to an FBA. First is to target the behavior and gather data. Direct classroom observations to gather data include anecdotal recordings, event recordings, time sampling, etc. Next, the team develops a hypothesis regarding the antecedent and consequences of the behavior and collects even more data to then analyze the student's behavior triggers. Using the data collected, the IEP team makes the best determination about what is causing the behavior and then creates a behavior intervention plan to teach and reward positive behaviors of the student. Having a behavior intervention plan based on FBAs is important in the event that a special education student with a behavioral IEP is suspended from school for more than 10 days. In this particular event, the law states that a procedure of manifestation determination be implemented to determine whether the student's IEP was both written and followed correctly. Because many factors need to be considered in the assessment process for behavior challenges, experts claim that it is important for multiple measures and multiple informants be used and the student's environment assessed. Additional measures can include structured classroom observations such as the child behavior checklist and the Connors rating scales, projective assessment techniques, which are more subjective, such as drawing tests and sentence completion tests, and computerized assessments for attentional issues. Additional standardized assessments can be carefully chosen for what they are measuring. For example, again, the Connors rating scale includes measurements for oppositional and attentional behavior, and the scale for assessing emotional disturbances includes all 5 required regulation to determine ED eligibility. Assessing social-emotional functioning. Social-emotional learning, or SEL, is a hot topic among educators and is part of the Common Core state standards. The Individuals with Disabilities Education Act requires that IEPs assess the student's, quote, social and emotional status if it relates to the student's disability, such as with autism, emotional disturbance, and some early childhood development issues. The process of assessing social-emotional function on our RTI framework begins on Tier 1, based on a school-wide SEL curriculum. Many school systems have adopted a robust social-emotional curriculum due to the mounting research showing the academic benefits. One study shows that social-emotional learning not only improves achievement by an average of 11%, but it increases pro-social behaviors such as kindness, sharing, empathy. It reduces stress and depression and improves student attitudes towards school. All general education students are eligible to receive Tier 2 intervention based on the Tier 1 data that includes their individual responses to the school's Student Needs Assessment Survey. These interventions can include small group counseling sessions led by school guidance counselors, which may focus on a specific skill such as empathy with follow-up progress monitoring. Since social-emotional functioning coincides with other disorders such as ED, Tier 2 and Tier 3 interventions may include small group and one-on-one therapy respectively with the school social worker or school psychologist. All students with IEPs whose disability encompasses the need to improve social-emotional learning will receive ongoing assessment. Some formal social-emotional measurements are specific to social-emotional development, such as the Behavioral and Emotional Rating Scale for school age and preschool age, and the Social-Emotional Assessment and Resilience Scales. Other standardized assessments are broader in scope and include subtests like the Connors and the Brigance assessments. Informal assessments, as noted, can include a school-wide school student needs assessment, functional-based assessments, and curriculum-based assessments. Assessing language. Because language disorders are often developmental and start in early childhood, the assessment process for many starts well before school entry. If a toddler or young child has a language development delay, she may be eligible for evaluation and early intervention. This process is different from the school-based RTI model previously discussed, as it begins with a comprehensive formal evaluation. Language disorders are not speech disorders. Language assessments collect data on receptive and/or expressive difficulties. As such, part of the evaluation will be performed by a speech and language pathologist. Like the RTI model, formal and informal measurements are to be administered by multiple examiners in various settings, including the young child's home, to provide the data needed for evaluation. The early childhood model looks like this. Step 1 is an initial screening. Here, the purpose of the screening is to determine whether an infant or toddler is suspected of having a disability and is therefore in need of early intervention services. Step 2 is the comprehensive evaluation with both formal and informal assessments. Some formal assessments for early childhood language order evaluation includes the Mullen Scales of Early Language, which includes receptive and expressive language assessments. The Kaufman Survey of Early Academic and Language Skills also includes receptive and expressive language assessments. The Briggs Early Childhood Screen 3. Informal assessments for toddlers in early childhood include parent observations and interviews, arena assessments, and interactive strategies to glean a more complete picture of the child. For children up to 3 years of age, an individualized family service plan is designed. For students over 3, an IEP is formulated. The transition process or transition plan will determine if an IEP is still needed or required or revised for school. For students who may not have had a language disorder diagnosis before school entry, but whose communication difficulties interferes with their academic achievement or normal development, the assessment process may begin in school following the RTI framework. Research shows a positive correlation between developmental language disorders and academic achievement problems. The American Speech Language Hearing Association recommends that language interventions focus on helping the student acquire the language skills needed to learn and succeed in the classroom, and that interventions should be addressed within the context of the curriculum. Formal assessment examples to provide data on students' strengths, needs, and intervention include the subtests and academic achievement tests, for example, the oral language segment in the Woodcock-Johnson 4. Adaptive behavior scales, for example, the Violin 2, and as well as speech and language pathologist assessments. Informal assessments include teacher-parent observations and interviews, environmental assessments, criterion referenced assessments, and dynamic assessments. Tier 2 or 3 interventions may include small group or individual sessions with the school's speech and language pathologist and ongoing progress monitoring. Because of the disproportionate number of English language learners identified with language disorders, the Association of Speech, Language, and Hearing Association recommends that part of the assessment process to include those criterion reference tests and dynamic assessments mentioned earlier. Dynamic assessments can provide valuable information as their pre-test, test, post-test format distinguishes between language disorder and language difference for appropriate planning of interventions. Assessing physical development. Like the assessment process for language functioning, physical development delays can be indicative of other disorders. Because physical development is connected to cognitive development, assessing physical development for early childhood interventions begins with a comprehensive evaluation to determine diagnosis and/or interventions. The process follows a similar trajectory. Step 1, we screen to determine if a child will receive an evaluation. Step 2, the comprehensive evaluation for eligibility begins. Formal assessments can include instruments that measure several categories of development delay and/or physical skills, including motor skills and coordination. These standardized assessments give valuable information such as development age score and percentile ranks. Examples include Miller First Step, Peabody Developmental Motor Scales, and Bailey II standardized assessments. Informal assessments can give the team a look at how the child's physical skills compare to a specific criterion, for example, motor skills, as well as information on how the child moves within various environments and by multiple examiners, with observations, arena assessments, interactive strategies, to name a few. Step 3, an IFSP or IEP is formed, and progress monitoring within those programs is done regularly due to the quick pace of growth and can include event recording and time sampling. For students who were not identified in early childhood or who may have more mild physical developmental issues, early identification and intervention is still crucial for their physical, cognitive, and social-emotional development and academic success. When a teacher or parent observes a student struggling physically in the classroom, be it handwriting, poor concentration, or other classroom demands, the occupational therapist or physical therapist should be notified. The occupational therapist can use formal or informal assessments to help determine whether classroom adaptations, Tier 1 interventions, or more intensive skill work and evaluation, Tier 2 or 3 interventions, are needed. In addition, students with physical needs based on a medical diagnosis may need student support interventions to succeed within the school environment. Some of the more common formal assessments used by occupational therapists include DASH-17 for handwriting and precision skills, Bailey Scales of Development 2, Peabody Developmental Motor Skills, and the M-FUN-PS Fine and Gross Motor Skills. Assessing perceptual function. Perception refers to how children use their senses to gather and understand information and respond to the world around them. Perceptual development is part of the foundation for children's learning in all domains, so early assessment and intervention may be recommended prior to school entry. Infants and toddlers use perception during interactions for explorations and to make sense of their experiences. Preschoolers rely on perceptual information to develop greater awareness of their bodies in space and to move more effectively to perform tasks such as kicking a ball to a friend. Early childhood perceptual functioning assessments can be part of an overall assessment process for problems like autism spectrum disorder. These assessments can include spatial relationship skills, visual perception, sequencing, and memory. The three-step assessment process includes the initial screening to recommend a comprehensive evaluation. The comprehensive evaluation then consists of formal assessments such as tests of visual perception skills 4 and the Bender-Gestalt test, and numerous informal assessments like pairing observations, interviews, etc. The third step includes progress monitoring of the prescribed intervention, ongoing assessments, including transition planning for school entry. The process of assessment for perceptual functioning within the school follows the same RTI structure discussed throughout the exam. Tier 1 focuses mainly on teacher-parent observations and interviews in various environments. Sensory processing interventions are usually administered and assessed by occupational therapists. Some of the most widely used measurements by occupational therapists for Tier 2 and 3 assessments can include Scholastic Functional Assessment, the Beery VMI, and the evaluation of children's handwriting. It should be noted that sensory problems should be considered for all referred students prior to administering other functioning assessments. Assessing students in each of the 7 areas of functioning provides educators the data needed not only to determine eligibility for special education services, but to guide educational planning for instruction and intervention services, enabling equity in education for all. Thank you for listening to Patty Sassano's final exam.